Good afternoon, everyone. We are back again with yet another interesting and engaging Facebook Live session. I am Dr. Namika from Sharda Hospital, and I'll be hosting this informative session. Today, we have our expert, Dr. Vikas Bhardwaj, who's the head and senior consultant, Institute of Neurosciences, Neurosurgery, Sharda Hospital, Greater Noida. Thank you for joining us, Dr. Vikas
Thank you.
Bhardwaj, today.
Thank you, Anamika, for inviting me for such a great initiative.
You're welcome, sir. So, before we start the session, let me introduce Dr. Vikas Bhardwaj to all our viewers. Dr. Bhardwaj has more than 20 years of experience in the field of neurosurgery. Sir has handled various numerous complex surgeries and cases and is well known for his expertise. Today, in this session, we will be discussing spinal problems due to lifestyle changes. So, Dr. Bhardwaj, please enlighten our audience and tell them about some basic information about spine problems.
Basically, spine is the topic we should be discussed more and more in nowadays because spine problems are increasing very widely, especially in youngsters. So, for that reason, we should be having a basic idea about the structure of the spine. Spine is a neuromusculoskeletal system. Basically, this is having three components. One is neuro itself, it means spinal nerves and the bunch of the nerve which is passing through the spine. And second most important thing is the bony canal, which is supporting this neural structure. To support this whole structure, there are muscles and ligaments, which normally at the time you are walking and we are doing something, we are taking postures. So these are helping this structure of bone to be in a normal position. So now we are having three types of problems with the spine. Sometimes the problem is with the muscles and the ligament which are supporting the spine. Sometimes this is because of some problem in the bone itself, like structural damage, bony fractures in etc. And sometimes there is a neural problem. If nerve is compressed or nerve is damaged because of any pathology. So we can say this whole of the structure is having problem in any of out of these three structural elements, and we can manage accordingly.
Okay. So, what causes these spinal cord injuries? Because you must be getting a lot of
Yeah,
patients in your OPDs who are
is
coming with lower backache.
yeah.
So, what is the time when you think that they should seek the medical attention for these lower backaches?
Medical spinal injuries can come in many different ways, particularly
Yeah.
if they come directly to the emergency department. They are very serious spinal injuries like fall from height, sometimes road traffic accidents, sometimes gunshot injuries, bullet injuries, or the injury of the heavy impact over the spine directly. So these are the serious spinal injuries in which fracture is there. Sometimes the neural tissue is affected, and the patient is having paraparesis, weakness of the lower limbs, or sometimes the cervical spine is affected. Then the upper limbs are having weakness. So this may be the serious type of the spinal injuries which are there in the emergency room mainly. But sometimes there is small accidental or we get the sport injuries can come to the OPD directly, like the disc disease in a young patient, it may be because of some sport injury, because the jumping, because carrying weight, excessive weight. Sometimes these are the some problems which the patient can come to the OPD directly with them. So both the type of the injuries we deal, these injuries are managed. Some are managed in the OPDs only, and some are requiring surgery in emergency.
So what are these spinal cord injuries and what is spinal shock?
Spinal cord injury simply means that we are having injury to any of the component of the spine. Sometimes it is affecting to the neural tissue, sometimes it is confined up to the bone only and the neural tissue is not affected. And sometimes there is a muscles which are supporting the spine, these are affected only. But spinal shock is a condition when the nerves are affected and the patient BP goes down and whole of the neural system which is supporting the vasculature of the body and maintaining the BP, this goes down and the BP patient goes into hypotension. It sometimes patient become unconscious. The weakness of the all over the four limbs is there. The patient is not able to wake up. Sometimes the patient is not able to move the limbs also. So this is the condition which is called spinal shock. So literally the spinal shock means the neural part of the spine is affected, and that is why the BP of the patient goes down.
Okay. And so, how is the spinal cord protected? Like, what should we do to protect the spinal cord?
Actually, there is a natural protection to the spinal cord by the nature itself. Like the spine cord is a neural structure which is surrounded by the bones, which is called spinal column or spinal tube, bony canal, and this whole of the structure is being supported by the muscles and the ligaments. So we have to manage our musculature, which is required to make our spine in a better shape always. If the muscles are not very good, like support system is not very good, the posture become the wrong postures can cause the weakness of the muscles, and that is why the spinal cord disorders start to happen. So in that way, we have to maintain our muscles and the ligament system by doing exercises and all these things, posture maintenance and avoidance of the wrong postures basically. So this way we can keep our spine in a better shape.
Okay, so I'm sure most of our viewers would like to know what are the good habits that they should do to
The first
protect
of all,
their spinal cord.
nowadays we normally see in OPDs that the youngsters which are using computers, screens for a very long time, they are having cervical pain and a back pain. These are the very common problems in the OPDs we face. So this is all because of their wrong postures. At the time we are having computer screens or any screen in front of us, so we have to maintain a chin and chest distance. This is a very important thing. We have to we have not to forget anytime. Like this distance should be more and more. Like our posture of the neck should be straight. If we are keeping a posture like this is wrong, and there is a pressure over the spine, and with the time slowly the this disc part comes out and is causing compression over the normal neural tissue. So we can say the posture is the first thing we have to maintain. Second, at the time we are going to gym or we are doing any physical activity, so we have to make our muscles activated first. This is called toning up the muscles, toning up of the muscles. If the muscles are not toned up, the any jerk or any jump, any weight can go to the spine directly. And to protect from this jerk and jump, we have to make our muscles toned up. So this is called warming up, or some say it is like toning up of the muscles. So we have to do spinal exercises for 5 minutes at least before we start any gym session, any sport session, any tennis, any badminton. So this is very important. Toning up the muscles of the spine to protect our spinal system.
Okay. So also, like we just talked about low backache,
Yes.
which can be very detrimental at times.
Yeah.
So how can this back pain affect the quality of life in various individuals?
The back pain is the most common medical problem in neuro OPD. Back pain is the most common cause. We take leaves from our work. So back pain is a very common problem in society, and this is increasing very fast, especially in youngsters and the computer workers and the middle-aged people. So this is all because we are not keeping our posture in a better shape. When we are sitting, our back should be straight like this. We should be keeping our spine as long as possible. The distance between the bones should be more and more. And for that reason, we have to sit straight always at the time we are sitting for very long hours, like in working hours, computer sittings. So this is the first thing we should keep in mind. Second, most important thing is at the time whenever we are going to use our muscles, the spine come into picture, we have to keep our muscles toned up. So this is also important, like in cervical region, same is in the lower back region. We have to keep always our muscles better in a better shape and a better form. So for that reason, we have to doing exercises and all for always.
So is there any cure for these various types of spinal cord injuries?
Yeah, this depends upon the type of the injuries first. Sometimes there is a very trivial trauma, very small trauma. In that case, there is no need of surgery. We advise the patient bed rest and some muscle relaxant, some medicines. These are required only. Sometimes there is a very serious injury and the bone is fractured. Sometimes the neural tissue is damaged. In that case, the patient may require surgery. So the surgery is mainly divided in two parts. Sometimes the surgeries are without any fixation. So these are normal surgeries. We go and we decompress the part of the neural tissue which is being pressed. And second, when there is a requirement of fixation also. The requirement of the fixation is there when the fracture is very severe and the pressure on the spinal cord tissue is very much. So we go for the fixation also.
Okay. So can poor posture also cause various nerve damages and can lead to spinal cord injuries?
Yeah, poor posture in a very slow manner can damage the spinal cord because the disc comes out very slowly. Over years to years, this disc can cause compression over the neural tissue, and ultimately the deficits can come like weakness of the foot movement. There's numbness over the legs. The pain is going down to your legs, and sometimes there's very severe lower backache also. So these are the features which can happen if the patient is having wrong postures for a very long time.
Okay. Also, so we've seen that there is so much um, psychological problems which are very common. There's
Yeah, when
depression,
the patient is,
anxiety,
this is a very
stress.
common aspect, very
Yes,
important
sir.
aspect. With the lower backache, the patient psychological status goes very weak. The patient feel that he's not able to perform his duties, his normal social duties, his normal professional duties. That is why the patient comes into psychological trauma. In that case, we have to not only we have to manage the patient's pain part and the spinal part, we have to manage the psychological issues also. So for that reason, sometimes antidepressant and anti-anxiety tablets are required to give to the patient.
Okay. So, sir, can this anxiety and stress also damage our nerves, our various parts of
Normally,
nervous
this is
system?
not scientifically correct that anxiety can directly damage to the neural tissue, but ultimately, the recovery of neural tissue requires a healthy brain and a healthy psyche. Definitely, the patient is in stress. Any recovery, any the recovery from trauma, recovery from any injury. So this will be delayed definitely.
Okay. So, our viewers also would like to know this thing that why is it so difficult to find cure for these spinal cord injuries?
Actually, spinal cord is a very sophisticated system. So this is very difficult. This requires a high grade technology and experience and like say in Apex centers only like Sharda Hospital we are having all the facilities. So this is really requiring advanced technology and experience. That is why it's not possible in small centers. So patient for spinal cord problems, the patient has to come to these centers only.
Okay. So one of our viewers, Mr. Deepak, would like to ask that is deep tissue massage good for spinal injury patients?
Deep tissue massage is required only when you are not having any pathology. But you are if you are having disc disease, any disc protrusion is there, or any you are suspecting any injury to the spinal cord. In that case, we have not to go for any massage. We have to keep the patient in a straight shape, like on a straight bed, and we have to start the treatment as soon as possible. But massages can be done only to a healthy individual, not to a patient.
Okay. And so, what is spinal compression?
Spinal compression simply means when because this is a tube, it's a bony tube in which through which the spinal cord or neural tissue is passing. If there is any fracture, anything, any pathology, the bone can cause compression over this neural tissue and cause deficits. So this is called compression over the spinal cord tissue. We have to decompress anyhow by the maneuvers, sometime only by the tablets, and sometimes the surgery is required.
So, one of our viewers would like to know what are the important vitamins which are required for the nerves?
Actually, the neuroskeletal vitamin is the most important is vitamin D. Vitamin D is not only important for the neural tissue but for the musculoskeletal system like muscles, like bones. So vitamin D is a magic vitamin which is very much required, especially at the time after 40 years of age, when its metabolism is very weak in liver. Its storage is very weak in liver. In that case, we have to take vitamin D very much regularly. Second most common vitamin which is required is vitamin B12. Vitamin B12 is called neurovitamin. It is required by the brain and by the nerves, by the spinal cord. The vitamin B12 supplementation is required, especially in old female. So these two vitamins are most important. Otherwise, vitamin A and vitamin E, these are required at the time the patient is healing from some spinal cord injury.
Okay. So, one of our viewers, Ritika, would like to know what exercises are good for the spinal cord.
Exercise at the time you are having any problem like disc disease or anything like this, then you have not to go for any exercise without the expert advice. But normally we can go when the patient is healthy and is not having any disc problem, then we can go for the extensor exercises. In that case, we lay down on a smooth surface like on a mat on the ground directly in a prone position, like our stomach is facing downwards, and then we have to get up from the front side of the body, like Superman, and from the rear side of the body. So this is called Superman posture also. and this exercises can be done in sets. One set is normally takes around 1 minute. So you can do 10 times. This is called extensor exercise of the spine. This is the this is the safest one, and this is very much effective. This is called Bhujangasana also in our Shastras.
So one of our viewers, Monica, would like to know, is osteoporosis also a type of spinal cord injury?
Osteoporosis is a disease of whole of the body. It's a deficiency of calcium in the bones of the body. It can affect the spine. It can affect any bone of the body. But this is very common in this old age female, when the storage of the calcium and the deposition of the calcium is very weak. So when the osteoporosis is in the scene, we have to be very careful in doing exercises also. We have to keep our postures in a very good manner. Otherwise, chances of fracture are very much. In that case, the surgery is very difficult. So we have to keep these patients very safe from the injuries and all, and manage by the tablets and the rest only.
Okay. So one of our viewers, Mr. Nikhil, would like to know that can these nerves be regenerated after damage?
Yeah, this is a very important question. Basically, spinal cord injuries can never be uh, recovered completely. Mean to say, when injury is there, there are two components. One is called temporary injury or temporary damage. One is called permanent damage. Temporary damage means the damage because of the pressure, because of any injury, which can recover. But some permanent damage is also there that doesn't come back. So, and any injury to the spinal cord, this can be divided into two parts again. So, some part will come back with the time, with the treatment, and some deficit will never come back. So, we can say the complete damage can never come back. This is non-repairable.
So another viewer of ours, Mr. Rahul, would like to know, can he do something, some medications or anything to make his nervous system more stronger?
Yeah, we should be very keen about our postures, because the postures makes him healthy in terms of spine. So we anytime we are standing, we are sitting for a long time, we are playing any game. So we should be very much careful about our spine posture. In mainly two part of the spines are very much important. First is cervical spine, and second is lumbar spine. These are two convexities of the spine in which we have to keep them straight as much as possible at the time we are having jumps, jerks, or we are carrying weight, or we are using them for a long time. So most important thing is we have to keep our these two spines straight as much as possible. The posture is first thing. Second, we have to think about the muscles which are supporting the spine. They should be healthy always. Like the god, we are the only creature which are standing on our spine, and we are walking straight. So these are the muscles which are supporting us. Actually, these muscles should be healthy. The paraspinal muscles, the exercise should be done for these muscles. These muscles should not be weak, and according to the profile of your work. Like if you are a army person, so you have to jump from the roofs also, sometime on the mountains also. So according to their profile, our spinal muscles should be strong as much as possible. Like if we are a normal person, we are giving a sitting job for many hours a day. So we have to do some exercises daily, at least for 10 to 15 minutes for the spine only. But if we are hard in a job of police or if force or army, then we have to give at least 1 hour to the spinal muscles daily. So this is the requirement according to your profile. So this is the second thing. The first is posture, second is exercise, and third is the vitamins, like vitamin and minerals. So these are the normal vitamin which are required for any musculoskeletal system. Vitamin D, vitamin B12, calcium, magnesium, vitamin A and E. So these are required, and some trace elements also required. So these should always be there in a sufficient amount to keep our spine healthy.
So one of our viewers has raised his concern that he's in a job where he requires long duration of sitting. So he's saying that how can this lead to his
Actually,
spine
long-term sitting,
compression?
yeah, I understand this, and this is a very common question nowadays. Long-term sitting is the most disastrous thing which can happen to any young age actually, and this is very common practice nowadays. We are sitting for many hours to hours completely. So first of all, we should not sit if it is not very much required. We should be sitting only when this is very important to sit for a long time. Otherwise, we should be having rest. and we have to stand in the free time wherever possible. Like if we are sitting for 3 hours, so after every half an hour we should be walking in the room only for 5 minutes. So this is very important to make our muscles in a better shape, in a better tone. When we are sitting, the muscles goes into a completely non-working status, and they are not supporting the spine. So your body weight is directly going to your spine when you are sitting for a very long time. For that reason, you have to be very careful. So sitting is first thing you should be avoiding as much as possible. But if you have you to sit for your professional requirement, so there should be gaps of 5 minutes after every half an hour, after every 45 minutes. For 5 minutes you will be standing or walking around.
Okay. Another viewer of ours would like to know that how long it takes to show signs and symptoms of any spinal cord injury.
Spinal cord injury, like any other injury, the signs and symptoms start to appear just right after the injury. The patient might be having weakness of the lower half of the body because there's any spinal cord injury in the lower back or upper back. The patient may be having weakness of all the four limbs of the body when the injury is there in the cervical spine. So this is very common that whenever we having the spine injury, we'll be having symptoms right then only.
Okay.
Normally,
So can sir, sitting for a very long duration can cause spinal compression?
yeah, this is the when there is you are sitting for a long time, the muscles are not supporting you. So this whole of the system, the spine, this is having a weight of your body itself directly. So in that case, there is compression over the neural tissues, over the disc tissues. So disc is a very soft material which is for the cushioning of these bones of the spine. But when there is compression and more compression, this comes out, and there can cause compression over the nerves there.
Okay, so another viewer of ours would like to was asking this question that he's having some gap in his backbone because of the height. Can it be managed?
No, this is the question is it's not he's not clear about his problem basically. The gap in the spine is I think this is not any disease, but if he's having pain in a particular part of the spine or he's feeling like gap, so it means simply means the muscle may be atrophied there. Muscles which is filling that part is not completely filling. That is why he's feeling gap there. So there this is not a disease as such, but he can come and he can be advised some exercises.
Okay. So then a lot of people would like to know that how do they manage their desk jobs if they're suffering from various spinal cord injuries?
Injuries after the spinal cord injury is a very serious thing. Spinal cord after a spinal cord injury, you would be able to do your desk job or your walking job or your standing job. This is difficult really, but after some time of rehabilitation, spinal rehabilitations, exercises, postural trainings, and the medical management itself, the patient may be able to do his normal routine activities. But this is very normal in normal spinal cord problems like disc disease. After only some days, like we do the surgery on first day, we discharge the patient on second day, and after 5 days only, the patient goes to his normal work. He can start the work after 5 days only. But this is about the disc problems. It's not about spinal cord injuries.
So can anxiety and stress also damage our nerves?
I already told you that it cannot directly damage the neural tissue, but definitely the healing of the neural tissue and the functioning of the neural tissue can be affected by your psychology. For that reason, anything can be affected by your psychology. If your psychology is not good, the body system will not work properly.
So before we end our session, one of our viewers would like to know that can L4, L5 injuries can lead to severe life-threatening conditions?
L4, L5 is the lowermost part of this lumbar spine. L4 is one bone, L5 is another bone, and between these two bones there is a disc which is called L4, L5 disc. The most common disc which can come out in youngsters is L4, L5 disc. Even at the time they are going for any game or they are jumping, they are carrying weight in gym or anything like this. So L4, L5 is a very commonest disc which comes out causes compression. It can cause some weakness of the foot movement. This is called foot drop. But this is only possible when severe compression is there. So normally patient comes even before this condition. Patient is having lower back pain, very severe back pain, and the numbness in the lower limbs and the foot. In that condition, this is called grade 2 compression. The patient comes normally in a grade 2 compression, but if the grade 3 compression is there, definitely the patient might be having this weakness also. So this is really threatening, but when the patient is start to have symptoms like pain is there, the patient should meet the doctor. At the time the patient is having pain, lower back pain, and this pain is going to your legs, this is called radicular pain. This is the first symptom, first grade symptom. Second grade, when the compression increases further, the second grade symptom is the patient feel numbness and tingling sensation over the lower limbs. This is the grade second. And grade third symptom, when the patient is having weakness of the joints, like foot drop, the patient is not able to make his ankle movements completely. So this is called grade 3 symptoms. After grade 3 symptoms, the surgery is required. The patient should come to the doctor as soon as possible in grade first and grade second symptoms, so that the surgeries can be avoided.
So one last question, Mr. Deshrat Singh wants to know that he's having a low backache in the spine since a very long duration. So can it be dangerous for him?
Injury in the lower back.
Yes, sir.
Yeah, I think this, if the patient is having injury and the symptoms of the injury is also there, the patient should meet to the doctor, the spine doctor, as soon as possible. Like, all the precautions should be taken till he goes to any doctor to take the expert advice.
And so before sleeping, he's having pain in his right lower limbs also, and there is severe itching also. So he's asking
Yeah.
that would be related to
This
each
may be
other.
related. This may be the grade first and grade second symptoms. Pain is grade first, and itching, or what will you say, the abnormal sensation. It may be in the form of itching. It may be in the form of burning sometime.
Yes.
So this may be grade second symptom, and he should meet the doctor or expert as soon as possible.
Thank you so much for sharing this information with us, Dr. Bhardwaj. The session
Ultimately, and to conclude these things, I want to say the spine is a very important part of our body. We should be taking care of spine as much as we are taking care of other parts. We are doing exercises, we are going to gym, and we are doing exercises for our biceps, for our triceps, for our legs, for everything we are doing. But we are not thinking about our spine. In my opinion, these two parts of the spine, like cervical spine and lumbar spine, these should be exercised very regularly, at least for 10 minutes daily. Even if you are not having very much time for gym, these two things should be done. So I'll give you two exercises, one for cervical spine and one for lower back. The first, cervical spine, so this is called extensor exercises, or we can call it isometric exercise of the neck. We keep our neck straight like this. We keep our hand on one side of our head, and we start to press from both the sides. Like, our head is trying to turning. We are intending to turn up, but we are not turning actually. And from this hand, we are pushing our head this way. So in that exercise, these muscles are doing taut. These are working. So this is the exercise for these muscles. Same from this side. This time this muscle is working. Same from this side, from front side. This is important. And same for this side. From back side, we are pushing our head. But in all the positions, our head is not moving anywhere and neck is not moving anywhere. This way, we are keeping our neck very safe, and we are making our muscles better. So this is the muscle, this is the exercise. This is very important for cervical spine. We can do 10 sets daily to make our spine better, cervical spine. Same with the lower back spine. We have one exercise which I have already explained, which is called Superman posture, or extensor exercise of the back. We lie down on a mat in a prone position, like our stomach is facing downwards, and we try to get up from front side of the body like this, and from the rear side of the body like this. So these two exercises, one for this lower back and one for this cervical, is kind of very important, and these should always be doing. And best of luck for all my viewers. And healthy spine should be the target of the life. Thank you.
Thank you so much, sir. This session was highly informative, and I'm sure that our audience have got all the information that they were looking for. Thank you so much for joining us
Thank
today.
you.